Hello, Namaskar. This is Dr Lokesh Bhatia. Welcome to LOK TALKS. Dear friends, today is 17th of May and today is a day to spread awareness on hypertension. So we'll be talking each and every possible aspect for the public awareness purpose on the topic of hypertension. Stay tuned to LOK TALKS till last. Dear friends, the script of this video, I have prepared it from this book. Right? This book is written, is authored by The Healthier Lifestyle, is authored by Dr. Bharat Rawat, who is a consultant cardiologist and executive director at Medanta Hospital, Indore. He happens to be my school days friend and we have been batchmates too. And he has written an excellent book. I'll try to post link of this book also in my description box. A lot of things he has covered in his book. One, those who are enthusiasts to know more about the healthier lifestyle, they can definitely download that and can go through this book. So the hypertension chapter I have covered up in this video and I'm sure you will like it. Namaskar, welcome to LOK TALKS. Thank you very much for subscribing to this channel for professional medical guidance, spirituality and meditation and life coaching. Here is my WhatsApp number. Do connect me in person if you have any question. Thank you. Hypertension is a condition in which blood pressure stays high for long periods of time. Persistently high blood pressure is undesirable as it puts undue pressure on your heart, blood vessels and other vital organs like brain, and it can result in brain stroke, what we call it as a brain attack or heart attack. So it can be a very killer status, and even in eyes also it can result in blurring of vision. So we all may be hypertensive and some of other family members also may be hypertensive, which we may not be aware of their hypertension status. So it's very high time to make ourselves aware. According to WHO, millions die each year because of hypertension worldwide. What causes hypertension? Well, the cause can be ascertained only in 10% of cases where the patient may have kidney diseases. So only 10% of cases cause can be detected. Most of the cases which has no cause at all, and it is called essential hypertension. Where the cause is detectable, we can treat the disease and the blood pressure can be managed. But for 90%, exact cause is not known. But there are factors which can be responsible, which are non-modifiable and modifiable risk factors. Let's understand what are non-modifiable risk factors, which are age, sex, family history, genetics or hereditary. Can we do anything for this? No. Right? So what are the modifiable factors? Number one is sedentary lifestyle. We know the solution very well, right? Avoid sitting for hours together. I have already spoken earlier on this particular topic, which is titled as Sitting is Worse Than Smoking. You'll find that video. Link I will submit in the description box. Brisk walking is another solution. Brisk walking means you are able to finish 1 kilometer in 9 to 11 minutes. Walk at least 5 to 7 kilometers every day. Spend at least 40 minutes in a garden on a walking track. Right? 40 minutes for 5 days in a week or 20 minutes 7 days of the week. At least 150 minutes in 1 week. Right? So that's how we can work it out and prevent the effects of a sedentary lifestyle. I can understand a lot of people, we have to sit on our chair in our offices, but then that's the solution to keep yourself active. Everybody cannot go to gym, everybody cannot do yoga, but yes, going to gym is one solution, doing yoga regularly is another solution, but anything if not possible, at least you can walk for 20 minutes daily, 40 minutes 5 times in a week at least, and on an average 150 minutes a week you should be walking regularly. Smoking. Smoking is a dual-edged sword, as the nicotine and the other toxic substances which it contains raises your blood pressure. At the other end, the drug used to address high blood pressure becomes ineffective. So, absolutely no smoking. Next comes is weight gain. Losing 10% of body weight in a span of 3 months is a great help to reduce high blood pressure, to control your blood sugar. Right? I've discussed in my previous videos all this. Next comes as dietary salt. All ready to eat foods, chips and all these things, pickles have high contents of salts. Papad, the famous Indori namkeen. So restrict your salt intake. Make it at least 3 grams maximum in a day, that is half teaspoon. Avoid fats containing or high cholesterol contents. Next is birth control pills. Those women who have been taking birth control pills should be aware that that can raise their blood pressure. Alcohol. Heavy alcohol consumption can declare a non-hypertensive into a hypertensive patient, and soon you will be with a physician to get your blood pressure managed. Many people claim that they take only 2 pegs every day, but prolonged period of consumption is definitely going to make you hypertensive. Next is most important factor is stress, and it's one clear single factor which makes one to become hypertensive. Determining the way you think about situations and people around you, your negative thoughts, are you habituated to raise complaints for everything in life? Check yourself, and how are you problem oriented or solution oriented? Increasing your resilience is the solution. I have published more than 60 videos. Those who have subscribed my video can go to my playlist of spirituality and meditation, and you will find the solutions how one should think. So resistance to acceptance is the only reason of stress. So what are the symptoms? Are there any specific symptoms? No, there are no specific symptoms of hypertension. By nature, hypertension is a silent killer. Many patients having blurring of vision, headache, dizziness, or getting admitted for the management of heart attack or their brain attack or their stroke. That is the time when they get detected to be hypertensive. So self-monitoring of blood pressure becomes very much mandatory, and we should be all aware of our blood pressure status. Always monitor in non-stressful conditions, preferably in early morning hours. After you are done your excretory routine, relax for 15 to 20 minutes and use the digital domestic models available nowadays in all the malls and all the pharmacy shops, and use the arm time models instead of using the wrist models. Do not use those surface finger touching models. There are certain apps people are marketing nowadays on Facebook and all, lot of ads. You will find that touching your finger will give you blood pressure. All bullshit. Don't go for it. So I think it will take a lot of years for us to be able to recommend you to all those touch finger monitors to monitor your blood pressure. No, that's not a good idea at all. Many BP recording apps are available nowadays to share your weekly recording with your physician. Once you have recorded it, you can feed on that, and that can be shared with your doctor. If you find 3 consecutive readings more than 140/90 recorded within a week time, you have to get your treatment started. Consult a physician, get your treatment started, and follow his advice. 1 or 2 recordings higher than 140/90 must make you to start working on your modifiable factors, which I have discussed a while ago, right? So that's very important to develop that awareness, to learn how to record your blood pressure. Before I close up, let's discuss about treatment options. Closer your BP is to 120/80, healthier you are. The blood pressure control pills are must and your physician doctors can only prescribe you if your blood pressure is more than 140/90. Let me remind you once again what I have said earlier. If you want your blood pressure pill to be effective, then quit smoking, right? What is the best time to take your blood pressure pill is early in the morning. Once you have finished up with all the routine excretory functions, relax for 15-20 minutes, take your blood pressure pills and record those in your smart apps. Share with your physician on a regular basis. If there is any readings which are frequently more than 140/90 with or without treatment, you will definitely need to start treatment or modify your drug management. Regarding the side effects of any antihypertensive medications, yes, there are certain side effects. By and large, majority of the patients do not experience much of side effects. Some patients may experience dryness in their throat, some patients may experience hoarseness of voice, and some patients may experience swelling in their feet. Report it to your physician. They will change the drug, will modify the dose, and it can be managed. Lastly, your question is, if my BP is getting recorded frequently on the lower side, that is by 90/60, is there any problem? No, there is no such disease documented in the literature as low blood pressure. There is no chronic low blood pressure disease, right? Relax for some time, take plenty of fluids, and soon your blood pressure will reach in a normal range. Nothing to worry, right? So dear friends, don't forget to watch this video, how to record blood pressure.
नमस्कार दोस्तों, आज जानते हैं कि घर में ब्लड प्रेशर किस तरह से नापे। एक कुर्सी पे बैठे जिसमें एक बैकरेस्ट है ताकि आपकी पीठ उससे लगी रहे। दोनों पैरों को जमीन पे रखें, इस तरह से क्रॉस लेग करके ना बैठे। इत्मीनान से बैठ जाइए अब 3 से 5 मिनट, रिलैक्स रहिए। पिछले आधे 1 घंटे में आपने कॉफी, चाय या स्मोकिंग नहीं करी हुई हो, पेशाब आ रही है तो पेशाब करके आए और 5 मिनट रेस्ट करने के बाद में ये कफ बांधे। ये कफ आपकी कोहनी से करीब 1 इंच ऊपर हो, इसके अंदर 1 उंगली जाए तो ठीक है, 2 उंगली जाए इसका मतलब लूज है। इस कपड़े का भी ध्यान रखें कि ये कपड़ा अगर पतला है या लूज है तो फिर ठीक है, लेकिन अगर मोटा कपड़ा या टाइट है तो उसको इस तरह से ऊपर ना करें, बेहतर है इसको उतार दें। दोस्तों 3 बार बीपी चेक करें, पहली रीडिंग को डिस्कार्ड करते हैं, दूसरी और तीसरी का एवरेज लें और दोनों आर्म्स में देखें, जिसमें ज्यादा है उसको सही माने। ध्यान रखें दोस्तों, ब्लड प्रेशर आपको नापना है, ब्लड प्रेशर आपको ठीक रखना है, ना खुद का बढ़े ना दूसरों का बढ़ाए। आपको बहुत शुभकामनाएं।
And I hope you enjoyed listening to this talk. Thanks for listening till this end. Click on thumbs up if you've liked it. If you have been watching my videos more often, do subscribe it. Don't forget to go through all my playlist of spirituality and meditation to address your stress. Thank you for subscribing LOK Talks. Those who have not subscribed, I request you once again to subscribe LOK Talks and make sure that you are sharing with all your WhatsApp groups, and don't forget to hit on the bell icon. Thank you very much.